In yesterday's briefing at the NOC-19 headquarters, Prime Minister James Marape says authorities are finalizing the immediate protocols for the administration of the Astra Zeneca vaccine for Papua New Guinea. He says while the vaccine is not mandatory, as much as possible, the health workforce must be protected, including other frontliners. The Prime Minister says the vaccine protocols are expected to be announced next week.
It is in their best interest to get themselves vaccinated. So we're working with WHO, working with our own MESAC, working with our health department and team of doctors who assist us from time to time. We have allowed for these vaccines to come in. The vaccine protocols are going in place, hopefully by Monday or next week. Those who need to be vaccinated based on their own, if they agree, especially our health workers will be given first consideration. And then the rest will roll on from there. I've also indicated those who work in our key places in the economy, if they want to get themselves vaccinated, they must be also in the list.
The first supply of the Astra Zeneca vaccine arrived earlier this week. However, the opposition leader has come out publicly criticizing its use while questioning its credibility. Mr. Namah urged the Marape government to withdraw its use in the country.
I do not want to see our government exposing our citizens to potential serious harm and offering them up as laboratory rats and guinea pigs for further testing of this vaccine. I see a far more serious health crisis if the Astra Zeneca vaccines causes serious side effects because of our country's weak and ill-equipped health system.
Mr. Namah's concern was dispelled by the Prime Minister. The Prime Minister says the vaccine is safe and applicable. PM Marape says the vaccine is here to assist the country end the pandemic and help the mass population.
Vaccine and voluntary or semi-talk, you feel you like kissing, but you kiss him next week onwards. But team medical line blame me by putting protocols. Outside, he can go first kiss him COVID-19 vaccine. Outside can come behind protocols by me establish him. Now you got proper protocol and a proper order long kissing vaccine. Suppose you feel you need long kissing vaccine. And I can't be irresponsible as Prime Minister not to have a vaccine available for those who need assistance in the immunity. Natural DNA and immunity is not strong enough to resist the COVID-19 and also the risk that is involved in it. So I don't fall for a response to opposition leader. As far as I know, he's the opposition. He's not in government, and government's got to do what government feels right, assisted by research and statistics.
Professor John Vince from the University of Papua New Guinea says the AstraZeneca vaccine has been used by millions of people around the world. Brushing aside its side effects, Professor Vince says the AstraZeneca vaccine is applicable for use in the country.
Why is this vaccine a good one for Papua New Guinea? Because it's safe, and I'll talk about that in a minute. B, it's easily stored. We can store it in our ordinary fridges that we have for storing our own vaccines, our polio vaccines, our measles vaccine, and so on. It's the same conditions of storage. It lasts for quite a long time under those circumstances.
Astra Thailand National EMTV News.